Now, there are major factors to be considered in developing an infection. First of all, the microbe has to find a portal of entry. It can be the skin, the GI tract, the respiratory tract, uh, urogenital tract. It has to attach firmly, and to do this it'll use the fimbriae or the capsules or the spikes or the hooks, the surface proteins. It's also got to survive the host's defenses by avoiding being phagocytized and dying and other things that your immune system might do to it. And when it gets in, it can cause damage and disease by producing toxins and enzymes, and causes cells to lyse. It causes direct damage, and it will cause indirect damage if the host doesn't respond appropriately and the response is excessive. Now, the existing host, they have to have a way to get out, portals of exit, like fecal matter or blood, or through the urogenital tract, or shedding of skin, or the respiratory glands. Other things that could weaken the host defenses and make you more susceptible to infection can be old age and extreme youth. You know, they always talk about during flu season that the elderly and the babies, the infants, are more susceptible and in more danger of death from the flu. Genetic defects, or if you have some kind of acquired defect in your immunity, if you've had surgery or organ transplants, or you got cancer or liver problems or diabetes, or you're taking chemotherapy, something that suppresses your immune system. Stress and then other infections also can weaken your defenses. Now, true pathogens are capable of causing disease in healthy people, in anybody that has normal immune defenses. This would be things like influenza virus, or plague bacillus, or the malarial protozoan. Opportunistic pathogens will cause a disease when the host defenses are compromised, or they'll grow in a part of the body that's not natural to them, like the Candida albicans. It's an opportunistic pathogen. Now, when we look at the major factors in the development of infection, we need to look at the definition of virulence. This is the severity of the disease. It depends on how virulent the pathogen is. And we use this interchangeably with the word pathogenicity. Virulence factor is a characteristic or structure that contributes to the ability of the microbe to establish itself in the host and cause disease and damage. And the Centers for Disease Control have adopted a system to categorize these pathogens. Class 1 are microbes that are not known to cause disease in humans. Class 2, you have intermediate virulence. Class 3 is intermediate virulence. And Class 4, it's highly contagious. These are viruses that pose an extreme risk for all humans. Now, the first phase is to become established. So they're going to use these portals of entry where they enter the body. They can do this if you have a nick or a scrape, abrasion, a puncture, or you've had surgery in your skin. They can enter your GI tract through food or drink or anything else that you ingest. It can enter through your oral and nasal cavities, or you can get it sexually through the urogenital tract, and you can get it transplacenta or across the placenta. The exogenous agents come from a source outside the body. The endogenous agents already exist on or in the body. This is your normal flora. So they're going to become established by entering, like the conjunctiva of the eye, or the respiratory tract, or the GI tract, or the skin, or the ear. Those are just different examples. This is a table that shows the estimated case numbers of the most common sexually transmitted infections and diseases in the U.S., and you see the papillomavirus tops that with 14 million. Chlamydia, 1,360,000. Herpes, 510,000. Syphilis, 21,000. And of course, the new HIV infections up to 35,000. Looking again at these portals of entry, Staphylococcus and Streptococcus and your HIV and hepatitis viruses enter through breaks in the skin. E. coli and Salmonella enter through the GI tract. Strep pneumonia, Klebsiella, Mycoplasma, they all enter through your respiratory tract. And of course, STD bacteria and Candida yeast come through the urogenital tract. And then transplacenta, we use this acronym STORCH, syphilis, toxoplasmosis, other, rubella, cytomegalovirus, and herpes simplex. And again, there's just the definitions. Exogenous agents come from outside the body. Endogenous agents, that's your normal flora that already exists. So the requirement for an infectious dose is the minimum number of microbes that are needed for the infection to proceed. If they have small IDs or infectious doses, I don't know why I'm having trouble with that word, they have greater virulence. A lack of ID does not result, it will not result in infection. So the requirements, how many you need to have, like for measles, is 1 virus. For tuberculosis, it's 10 to 50 cells. For the plague, 100 to 500 cells. Gonorrhea, 1,000 cells. So you can see several of these are considered potential bioterror pathogens.